you?
Good, how are you?
Good. My name is Katie. I'm going to be your nurse today. Can I ask your name and date of birth?
Brittany Bailey, 7/31/2000.
Okay, so we are going to perform a head-to-toe examination today. So to begin your head to toe, I'm going to inspect your scalp. Can you bend your head down just a little? Okay, no lesions, no masses. Your hair is well groomed. I get you to clench your jaw for me. Okay. Everything is equal, bilateral. So we're going to test some cranial nerves. Can I get you to smile? Okay, now puff your cheeks. Okay, and everything is even and symmetrical. I am going to feel your temporal arteries. Okay, even pulses bilaterally. Can you tell me if you have any tenderness at all? First we'll do frontal. Any tenderness there?
No.
Okay, maxillary. Any tenderness?
No.
Alright, we're gonna do lymph nodes now. Pre-auricular, post-auricular, occipital, submandibular, submental, supraclavicular, and then we also have the cervical chain. Now I'm going to feel carotids. 2 plus and regular bilaterally. Alright, we're going to do some range of motion with your neck. Can you look up at the ceiling, down at the floor, left and right? Good job. I'm going to feel your trachea now. Trachea midline. I'm going to have you push up with your shoulders against my hands. Okay, good job. 5 out of 5 on tone strength. So I'm going to inspect your eyes, your lids and your lashes. I'm going to pull down. Okay, and then I'm going to pull up. Okay, your conjunctiva is pink, moist, and your sclera is white. No abnormalities. Now we're going to do a vision test, okay? I'm going to have you step to the 3rd block. So read the furthest down possible with your right eye covered.
I can see line 6,
Okay.
E, D, F, C, Z, P,
Okay. Can you read number 7?
F, E, L, O, R, Z, D.
Okay, so right eye is 20, 30. I'm going to cover your other eye and look for me.
Okay, I can see E, D, F, C, Z, P.
Okay, and what about the line below that?
I cannot see anything but a D.
Okay, so right eye is 20, 30 as well. Can I get you to look once your eyes have readjusted? Tell me which line you can read.
F, E, L, O, P, Z, D.
Okay, how about the next one?
D, K, E.
Okay, so bilateral 20, 25 vision at line 7. Okay, so I'm going to check the red reflexes in both of your eyes as I am going to turn off the light. If it's irritating to your eye, let me know. Please stop. Good reflexes bilaterally. So now we're going to check your eyes and see if your pupils are restricting like they're showing. So I'm going to come in with this light from both sides, okay? Visual response with both eyes. Now I'm going to come from a distance in near for accommodation, okay? Right. Okay, good job. Pupils are equal, round, reactive to light and accommodation. We're gonna do your extraocular movements, so we wanna make sure that they're intact. You'll just watch my finger. So we are going to keep your head still and only follow with your eyes. Start here. Good job. So I'm going to have you take your hand and put it up like this so we can make sure that they're constricting. Okay. All right, good job. I'm going to inspect and palpate your ears on the outside, and then I'm going to look on the inside, okay? Right ear appears slightly smaller, but no abnormalities, just a little symmetrical difference there. And then now I'm going to inspect the canals and see if I can see your tympanics. I'm going to pull up and down. Okay, tympanics intact, good kind of light. Good cone of light bilaterally and pearly gray. So now I'm going to perform a whisper test. So I'm going to go behind you. I'm going to have you cover your right ear and repeat the words that I say. Cow, dog. Okay. Now cover your other ear and repeat after me. Dog. Okay, good job. So test is within normal limits. I'm going to check your nails, make sure that everything's normal. Okay. Nails are patent, clear, no masses, no deviation. Septum is intact. Now I'm going to test a cranial nerve, so I'll have you close your eyes. And I want you to tell me when you smell and what you smell. Alcohol. Okay. Good job. So I am going to inspect your mouth and make sure everything looks good. I'm going to use this light actually. So lips, no cracks, everything looks good. And if I can get you to just open, chew cheese, stick your tongue out, say ah. Okay, move your tongue side to side. Good job. Uvula midline, tongue midline, moist, move side to side. Cranial nerves are intact. So now I'm going to listen to your posterior lumps. First I'm going to inspect and then we will listen. You're going to feel my fingers on your back and your neck, okay? Tell me if you have any pain or tenderness. No. Before I do that, let me have you breathe. Take a good deep breath for me so I can check your chest expansion. Movements are equal. And I already felt your spine, no tenderness, correct? Okay, so I'm going to check your kidney. You tell me if you have any pain at all, okay? Any pain? Any pain on that side? Okay, you're going to start with your right elbow. spacious breath sounds. I'm going to listen to your anterior lungs. So I'm going to start with your right upper. Deep breath. Right middle. Good. And left upper. Okay. Clear. Not diminishing basis, no adventitious sounds. So now I'm going to check your PMI. It's going to be mid-clavicular, fifth intercostal. If you'll lift your breast for me. Deep breath. Good job. Everything sounds good. Everything is equal. I am going to check your nails just to make sure there's no clubbing or anything abnormal. And your capillary refill should be less than 2 seconds. Yes. Okay. No clubbing. Shape is normal. No abnormalities. Color is pink. Now we're going to check your skin curve. If you don't mind to open your shirt a little, so it's right under your clavicle. Just no skin tinting, no dehydration noted. I am going to check the PMI again. Left fifth intercostal space. So if you don't mind to lift your breast for me. Listen to your heart valves. So we will start with the aortic valve. Go over to the pulmonic valve. And then the Erb's point. Do you mind to lift your breast for me? Thank you. Okay. And then tricuspid. And then mitral or apical actually. S1 and 2. Both present. Normal sounds. We're going to do pulses. So radial. Okay. Radial. Femoral here. I'm going to do popliteal. And then if I can get you to remove your shoes, one of them. I'm going to do the posterior too, and then the dorsalis pedis. All are 2 plus and regular. So now we are going to go over self-breast examinations. Do you do those at home? Yeah. Okay, so we're going to do some teaching on that. So you're going to want to look in the mirror with your arms at your sides, and then overhead. So you're going to reach above your head with both arms. Then you're going to put your hands on your hips. You want to look for skin changes, nipple changes, any dimpling, kind of like an orange peel. If you see that, you're going to want to call your doctor. You can lie down with a pillow under your shoulder and your arm behind your head. You want to use 3 fingers in small circular motions. You can do different types of pressure, light, medium, and deep. You can also use a vertical pattern going down, so you're going to want to do this, and then that's the vertical strip, and you can start clavicle to brow line, sternum to axilla, and then tail to stents. Look for nipple discharge. You're going to want to do this 3 to 5 days after your menses, or the same date of each month. If you need any help, I will provide you with a copy. Okay, now I'm going to listen to your abdomen, if you don't mind to lay back for me. Inspect first. So upon inspection, everything seems to be normal, nothing abnormal. Now listen now. I'm going to start at your right lower quadrant, so you're going to hold the stethoscope. vital sounds are normal active. Now I am going to percuss. So tell me if you have any feelings, okay? Tapping throughout. I'm going to palpate, so I'm going to start with a light pressure. If there's any tenderness or discomfort, let me know, okay? Now I'm gonna go a little deeper. Again, any pain or discomfort. Okay, everything feels good. No abnormalities, no masses, no tenderness upon examination. So I'm going to check your extremities. Make sure everything's symmetrical, so I'm just gonna kind of walk down on the corner. Alright, I'm gonna check your ankles. Okay, I'm going to check for edema, so I'm going to put your fingers in there. Came right back, everything's good. Normal hair distribution, no edema noted. Everything is symmetrical. So I'm going to give you 4 words to remember at the beginning of this exam. Cat, dog, cow, bird. Okay? Just remember those for me. So I'm going to have you stand up. I'm going to have you bend forward and try to touch your toes. If you can't, that's okay too. Okay, now lean back. And then go from side to side. Okay. Spine within normal limits and range of motion is intact. Let's try the neck, go up towards the ceiling, down to the floor, to the side, to the other side. Now go around. Good job. Range of motion within normal limits for her neck. Gonna do arms, so we're gonna do extension and then flexion, extension. Okay, good job. And then we are going to do your legs. We're gonna do abduction, adduction, and then extension and flexion. And then can you roll your leg for me? Good job. Okay. So now I'm gonna have you bend over so that I can walk your spine with my fingers to make sure there's no curvature or tenderness. Okay. Tell me if you feel any pain. Slight curvature noted near brow line. While we're standing, I'm gonna have you do a tandem walk. So if you can start back there for me, try to follow the line, heel to toe, 1 foot in front of the other. Okay, good. We are going to do the Romberg test. So I'm going to have you put your feet together, arms at your side, close your eyes for me. Okay, minimal sway noted. Now I will have you to sit back down. I'm going to do what we call a sensation test. It's going to be with your upper and lower extremities. So I just want you to tell me if your sensation is soft, dull, or sharp. So have you close your eyes? Okay, now move to your leg. Shut. Okay, another one. Shut. Okay. Sensations are intact, no abnormalities. Now we are going to do finger to finger, finger to nose. To do like this, and then together. Now go back out, close your eyes, bring them back together. Good job. Let's do finger to nose, and then chin. So I want you to take your finger, touch your nose, then my finger. Again. Okay, now close your eyes and touch your nose and come to my finger. We are going to do one of your heels to your shin, rub down. You're going to do that 2 times. Okay, this one to that one. Good job. Now we are going to test your grip. I want you to squeeze my fingers, okay? Good job. 5 out of 5 core strength. Now we are going to do your reflexes. Okay. Alright, just relax for me. Good job. So her mini cog is within normal limits. Everything was intact. What 4 words did I ask you to remember at the beginning of our test?
Cat, dog, bird, cow.
Good job. Okay, so now her mini cog is within normal limits. Everything was great. She's done a good job. And this is the end of the head to toe.